Hi everyone, my name is Sarah Wilton and I am an epidemiologist here at the Jefferson County Health Department. Today we are going to be going over the COVID-19 data for CDC week 29, which is the week starting July 12th, ending July 18th. Just to remind you all, this report includes data from last week and is meant to give you a snapshot of what is going on around the county and the potential trends that we might be seeing. The numbers and the case counts that you see on our Facebook page and on our website include the totals from the most recent days, so be sure to check those out for the most up-to-date numbers. Let's go ahead and start reviewing our data from week 29. We had a total of 172 lab confirmed and probable COVID-19 cases within Jefferson County, which brings us to a cumulative total of 902 cases. We now have a total of 25 COVID-19 associated deaths as of week 29, which has increased since last week. We also now have a total of 8 outbreaks within our long-term care facilities, which has also increased within the past couple weeks. Just a reminder, an outbreak in our long-term care facility population is considered as one or more persons testing positive for COVID-19 in either the residents or the staff. First, we look at Table 1, which shows our weekly numbers of lab confirmed and probable COVID-19 cases, along with our cumulative totals. Looking at week 29, we have seen our highest total yet with 172 cases, bringing our total to 902 lab confirmed and probable cases. We have seen a high increase throughout the past 2 weeks, so we are continuously monitoring and investigating these cases in order to help slow the spread in our community. Here in Figure 1, you see a visual representation of our weekly case count, and the trend is moving upward as time is moving along, even though we had some weeks where our numbers were a little bit lower. The overall trend of cases is increasing. Figure 2, we see the cumulative COVID-19 weekly case count. And here you can see we had a pretty slow and steady rise in the beginning, but as of recently, we have had a more drastic increase in cases as represented by that steeper line nearing the right side of your graph. As we move on to Figure 3, we again see our daily case count, this time with an overlay of a 3-day average, which helps to give us a better visual of how our numbers are moving along. So sometimes we have those very high case count days, sometimes we have those very low case count days, which can make things a little confusing if you're just looking strictly at those numbers. So in this graph with our 3-day rolling average, it helps to smooth things out a little in order to truly see that trend over time. Figure 4, we see the lab confirmed and probable cases separated out by age group. We are now seeing the highest amount of cases in our 20 to 29 year age group with 160 cases. The number of cases in this age group has been steadily increasing over the course of the past couple weeks and has now surpassed all the other age groups in terms of number of cases. We'll be keeping a close eye on this age group and some of our other younger population groups as we begin nearing the start of school this fall. As we look at the rate per 10,000, we see that our 80 plus age group has the highest rate at almost 80, with the 20 to 29 age group close behind there at 61. Moving to our COVID-19 hospitalizations and hospitalization rates, our 60 to 69 year age group leads with 22 hospitalizations. We did have new hospitalizations in the 20 to 29, the 40 to 49, 50 to 59, 60 to 69, and the 70 to 79 year age group. So almost every age group. We are seeing the highest rate per 100 in our 70 to 79 year age group there with 27.6. Some, but definitely not all of our hospitalizations include those long-term care facility populations. We will go into some of the statistics, excluding our long-term care population, a little bit later in this video. Figure 6 shows us the hospital admissions and a 7-day average, similar to the rolling average that we looked at for our daily case count. Here you can see the dates at the bottom are the date that the hospital admission was reported to us here at the health department. I do want to point out that cluster of dark blue bars toward the right side of your graph and that light blue line that you can see moving upward on top of that cluster. Because we have been seeing a large increase in cases, we are also seeing an increase in the number of hospital admissions. So even though you may be hearing about people with mild symptoms or even no symptoms at all, we are definitely seeing an increase in the number of people here in our county with more severe symptoms, enough that they would be admitted into the hospital. Next, we are looking at our COVID-19 fatality count and fatality rate by age group. The large majority of our fatalities have occurred in our 80+ age group. We did have 2 deaths this past week, which brings us to a total of 25 deaths for the county. We will also be watching these numbers as the coming weeks go on because our fatalities usually do come a little while after those case numbers spike. Table 2 shows us the fatality rate as compared to Missouri and as compared to the United States. Jefferson County's cumulative fatality rate is 2.77%, which is below the average for both the state and the entire country. Figure 8 divides our cases by sex. We continue to see the most COVID-19 cases in our female population with 483 cases, which is about 56%. Next, we get into our lab confirmed cases here in figure 9. This shows the weekly PCR test results for our county. These results are strictly PCR lab tests, so this does not include the antibody tests or the probable cases. This past week, we saw approximately 8% of our test results come back as positive. That dashed dark blue line shows us that percent positive of all the tests. And you can see over the past 2 months, it has been trending upward. Table 3 breaks down the positive and negative test numbers. So looking at the bottom there, we had 154 positive tests last week during week 29. And here you can also see that percent positive was 7.9%, which is a clear increase from the past 3 weeks. Figure 10, we see our COVID-19 cases by rate per 10,000 residents. Our white population now has the highest case rate. This population also accounts for 797 of our total cases. Keep in mind that all of our race data does not include any missing or unknown race data. Figure 11 shows our cases by zip code. We see the highest number of cases in our 63028 zip code, which is our Festus area. Again, there are some long-term care facility cases in this particular zip code, so we will go over the data excluding those long-term care centers in just a couple minutes. Our Arnold zip code 63010 is showing a very large number of cases as well. There were 32 new cases in the Arnold area alone this past week. As we move to figure 12, we see the COVID-19 cases by zip code per 10,000 residents. So this chart gives us a better idea of cases within each area as determined by their individual populations. As we know, some of our more populated areas have higher case counts, so this breaks it down a little better for us, taking the population into consideration. Again, we see our Festus zip code with the highest rate at 58.7 per 10,000. And our Cedar Hill area, 63016, has the next highest case rate with 46.2 per 10,000. Let's move into our weekly report of COVID-19 cases, excluding the long-term care facilities. As we know, residents in those congregate living centers, such as long-term care facilities, tend to be at a higher risk for contracting a communicable disease such as COVID-19 because of those close quarters that they live in. What is interesting as of lately is that we are seeing a large increase of cases in our general population, not just those long-term care facilities. Looking at Table 1, which shows our number of confirmed and probable COVID-19 cases, excluding the long-term care facilities, we see that the past 2 weeks have had large increases in our general population. We actually only had 3 cases in our long-term care facility population last week, which was week 29. And if you look at week 28 there, we actually only had 4 cases in our long-term care facility population. Figure 3 shows our confirmed and probable COVID-19 cases and age-adjusted case rates. Here, when we take out those long-term care facility cases, which could be both residents and staff of those facilities, we see that our 20 to 29 year age group, again, has a very high number of cases. Lastly, as we look at zip code data again, in Figure 9, our Arnold area, 63010, shows our highest number of cases with 120 when we exclude those long-term care facilities. Imperial, 63052, is also showing a high number of cases when we exclude those long-term care facilities. The number of cases in these 2 particular areas has doubled over the course of the past 2 weeks. That's all we have for you today for our Jefferson County COVID-19 stats. Thanks for tuning in with us. Remember to check our website, jeffcohealth.org, and our Facebook page for the most up-to-date stats and recommendations regarding COVID-19. I hope you all remain safe and healthy as we continue to navigate the coming weeks together. Have a great day and a safe weekend.